In this other model, we can also see the aortic arch, A, and the first thing to branch out is B, the brachiocephalic artery. So this is the brachiocephalic artery. Then the second thing to branch out is C, the common carotid artery, and the third thing to branch out is S, the subclavian artery. So A, B, C's. Now, this is the left side of the heart. So this is the left common carotid, and this is the left subclavian. Now look at this. This is the brachiocephalic artery. Can you notice that in this model we can see the two branches, one going towards the arm and another one going towards the head? So this is the common carotid artery, but this is on the right side. So this is the right common carotid artery, and this is the right subclavian artery. You need to remember that something that's going towards the head will be pointing up. So these are the common carotid arteries on the left side and on the right side. And something that's going towards the arm are going to the sides because they are named subclavian. It makes you recall that they will go underneath the clavicle, and they will end up in the upper limb. This is the right common carotid artery, and this is the left common carotid artery. And then here we see that we have veins. But these veins are not named carotid. What happens is that the little pair for the carotid arteries are the jugular veins. And specifically, this is named the internal jugular vein. This is on the right side, so this is the right internal jugular vein, and this is the left internal jugular vein. Now, right here, we have veins that are bringing blood from our upper limb. And these veins, they go underneath the clavicle. Consequently, these are the subclavian veins. This one is from the right side, this is the right subclavian vein, and this one is the left subclavian vein. When something that comes from our head gets together with something that comes from our upper limbs, they form a trunk that is named brachiocephalic trunk. So we have a brachiocephalic on the left side, and we also have right here on the right side. Consequently, this is the right brachiocephalic vein, and this is the left brachiocephalic vein. When the right and left brachiocephalic veins get together, they form your beautiful superior vena cava that brings blood towards the right atrium. So here is the superior vena cava, which is receiving blood from the right brachiocephalic and the left brachiocephalic veins. Now, if we look at the posterior aspect of the superior vena cava, we see here that we have a vein that is clicking into the superior vena cava. And this vein is what we call azygos vein. So the azygos vein is basically a different route that can bring blood from the lower parts of our body and dump it into the superior vena cava, and then this blood arrives at the right atrium. And we also see here in the posterior aspect of the heart, the inferior vena cava, bringing blood from the inferior aspect of our body.